Oh, we're not used to taking roll call. We're not used to taking roll call. Okay, as you see, there was something that came up that said that we're now live streamed. So they've started the public meeting. So is Jim Miola or somebody from Cleveland Clinic on?
Bill Burnett's present.
Thank you, Bill.
Thank you, Beth.
University. Oh boy. I don't know who that was, but I couldn't hear them.
Bob Sable's here.
Oh, hi, Bob. Thank you.
Hey.
For UH. Do we have someone from the medical examiner? I know I saw Hugh coming on.
I'm here.
Yeah, all right, great. Do we have anyone from EMS? Bruce Elliott? Okay. Anyone from St. Vincent Charity? Dan Woodrow? Do we have anyone from Southwest? Mary Kazmierczak?
Hi, Beth, it's Mary. I'm here.
Hi, Mary. All right. Do we have someone from CDPH? I think I saw Tommy on.
Yep, this is Tommy, dude. I'm here.
Hi, Tommy. All right. Let me see if we needed any other. Do we have someone from the Cuyahoga County Office of Emergency Management? Kevin Priest?
Good afternoon, it's Kevin Fries.
Hi, Kevin. Thank you. And do we have anyone from the VA? Jason?
Yes, I'm on.
All right, very good. All right, so our quorum has been established. So we do have enough folks to vote. All right. So we'll start right away with our agenda. Were there any public comments that came in? Kevin, do you know if there was any public comments that came through?
There were not.
No public comment? Okay. Approval of the minutes of the 6/25/21 meeting. They were sent out on your appointment. Were there any questions or concerns for those minutes from last year?
None, and I would make a motion to approve as written.
Okay, so there was a motion to approve. Is there a second?
I'll second.
I'll second.
Jason Sorgan?
Beth, this is Andrea. I just have a question about the date. Is June the 25th, 2021, correct?
What was it? Was it June?
It says on the first page, it says June the 25th, 2021. And then on the second page in the top in the header, it says September 27th, 2019.
Oh, that was probably left over in the header. Okay, yeah, I can change that. I will change that.
So I'll make an amendment. I vote to approve the minutes with the header date change to comport to June 2021.
Okay, great. All right. Thank you. And Jason seconded. All right. Okay, so, all right. Okay, all in favor
Aye.
of approving with the header date change? Yeah, this is really weird with a virtual thing, right? Okay. Does anyone disapprove? Okay, thank you. Then the approval of the minutes has passed with the header date change. All right. Moving along, just a short review of our last CCESAB meeting. So the last CCESAB meeting was held on April 14th of 2022. Updates were given by the committees. The EMA committee mentioned that the Health and Medical and the Public Works committees would be joining them in the near future to assure that a quorum was met and that our project management would be accomplished. So we're just waiting for approval from, I think, their council members or their board, the board to have the health and medical and public works committees be combined with the EMA committee. As you know, we don't meet very often because we have other venues to do our work through. So I think that it's a good idea to combine our work group with an active work group. All right. The EMA also talked about their new web EOC Javari project that will soon be replacing Knowledge Center, or I think it's already replacing Knowledge Center. I believe some hospitals will have access to this new web EOC project, but we'll learn more about that as that project rolls out. And that will hopefully be able to interface with the new Javari EM resources and EM tracker that we're going to get for hospitals for patient tracking. There will be a subcommittee that is created to look at the new EM resources and EM tracker that will be taking the place of SurgeNet probably within the next year. We get to design our own webpage, so look for some invitation to sit on a subcommittee to help design our webpage into what we want to see for our region. We'll be able to do situational reporting on there throughout the Healthcare Coalition, and all of our bed updates and patient tracking will be kind of transposed into that new Javari system.
Beth or Kevin Freeze, rather.
Mm-hmm.
Can you, is there like a marketing material, introduction about what these modules are with Web EOC that you can share?
So we are actually in the infant stages of this transition. So we actually just got off of day one of our quote unquote boot camp. As we go through the process, we will definitely be sharing information on those modules and also training, et cetera.
Yeah, I mean, if there's any marketing, just so I can socialize it, start socializing it here.
Gotcha. I will ask.
Thanks, sir.
All right, just to continue the update of the CCESAB meeting, the Emergency Management Subcommittee also updated on their PPE warehouse push of the testing kits and the extraneous PPE, which is, basically taking them pretty close to their anticipated cash levels. So they have a few items left in there, and I think they're reaching out to some of the agencies to see if they will take some of those soon to be expiring COVID test kits and PPE and things like that. So they are still open, I believe, on Fridays. But if you want or need anything, they're available to take your resource requests. I think one of the other things we brought up was if anyone is considering the nonprofit security grant this year, it's going to be posted to the state website, and you will apply directly on that site. I think I usually get an email from the county, and then I send it out to you all with the information, but it should be posted on their state website, and then you're just going to apply directly on that site this year. So a little bit different for that. Usually that comes out in around July or August. So look for that if you're used to the nonprofit security grant. A lot of that is used for security cameras and, some of those hardening of your infrastructure there. And one of the other things that was announced, and the reason that we're having this meeting is that Cleveland may become a UASI city this year. They have it under good good efforts that we will probably, or, you know, Cleveland, through Cleveland, will be able to fund some available projects for UASI. We needed to have our requests into the EMA by, or not to the EMA, but to the grants department by May 2nd. So that's why we're kind of meeting today to put our projects forward and to prioritize the request that we would like to put in for UASI. It seems that we might have moved up a slot. We won't exactly know until really after we've put in our request for projects. So, so that's why we're here. Just on the offshoot, our FY17 UASI project has been completed, and all of the supply items, you know, all the PPE kits, filters, the ID con kits and everything have been delivered to the hospitals. So that's the only UASI project that we had outstanding. As far as the other Homeland Security grant program outstanding projects for Cuyahoga County Board of Health, they put in the request for the cybersecurity hardening for some of their buildings there. So I haven't heard anything. I don't know if that's started yet, but that is in the works. So the grants department is working, will be working with CCBH for that. All right.
Beth, Beth, this is Larry from Public Safety.
Yep.
You mentioned the nonprofit security grants, and I just wanted to sort of update. There is information on the state's website, emaohio.gov, for the preparedness grants about the nonprofit grant, which is expected, as it says here, expected to be released on or prior to May 13th, 22. And like the other grants that we're dealing with this cycle, the window for returning an application will be short, maybe as short as a month. So by June 13th. So, but folks, if they look to apply, I just sent you the link to this this page on the state's website that you can pass out if you would like. That's all.
Yeah, thanks, Larry. Yeah, I just saw it come through. So very good. So I can send that link out to this group so you don't have to go searching for it. All right. So we'll have two grants that are basically due by May 13th, and trying to get all those things in. So so I think we just have to have basically a discussion regarding any projects that this group would like to pursue for this UASI grant, in which we have to have the applications, or at least what we want to prioritize as a project, due into the grants department, I believe by May 2nd. And then we have to have the written request, I think, due by May 13th, it looks like. So we want to get this done. Let me see, let's take any discussion for any projects that we would like to pursue. I know the medical examiner's office sent in a request to add some field storage capabilities with a portable cooling system, like a MERC system, something like that. Most of the hospitals know what a MERC system is. They've seen those, some of them have them, but they're looking for field storage capabilities. They're between $40,000 and $60,000, depending on a large system that you're looking at. Ideally, they would like a 48 body capacity. Let me see, which would be around maybe $80,000. So does anyone have any questions for Hugh? I know that he sent the email to everyone, so I'm sure most folks looked at that. Does anybody have any questions for Hugh regarding those cold storage, field storage capability?
Beth, before then, we just went through a thyroid exercise. Has that changed for Cuyahoga County? Have our threats changed?
I
No,
know,
the top ones shifted around a little bit, but nothing from like top 10 has actually dropped off or anything been added.
So what's our top
Priority.
three? What's our top three, Kevin, if you recall?
I'm
pandemic.
getting old, Mark.
It's a health emergencies, which includes a pandemic and Ebola and things like that. So epidemic, pandemic type of a deal. I know that was number one. And then it was, what was it, weather? When they.
Severe weather and then
Yes.
extreme temperatures, I believe.
Yeah, so it's, so the severe weather takes into account winter and summer weather.
Okay, well, I just wanted to get a sense of if anything changed, so.
Yeah.
Hugh, on your rack mounted system, is that something that, if hospitals hit capacity, they would take advantage of that, or what's your vision on that?
So this one, what we've learned during COVID is this last bump, December, January, we were pretty much maxed out. We installed racking systems in our coolers at the facility, and there's going to be a phase 2 of that. So we're trying to expand our in-house capacity to deal with those. We did have to have refrigerated trailers sent up. We didn't actually end up using them, but we were right at that breaking point. And, if we are at another high watermark with the pandemic, and then we have a disaster to deal with, we've got no capabilities, in the field, other than our mobile unit, which is 8, will hold 18, and that'll be more for transport than field storage. So these Merck systems are pretty flexible. The largest size is for 48. My suggestion is to get 2 24s to give us a little bit more flexibility, because you don't know what kind of space you're going to be dealing with out in the field. So it's a little bit more expensive to do 2 units, but they're easier to move around because they're smaller. So.
Makes sense. Thank you.
And then Beth,
that helps.
and I pulled up our gap analysis. So for fatality management services, we listed, or the group listed, 250 as our current capability, and our target capability was 500. So we definitely have a gap to fill based on our latest fire SPR.
Thank you. Yeah, I think it's probably money well spent.
All right. Okay. Thanks for the discussion. Any other projects that folks would like to bring forward? Remember, UASI is more of a, we can justify it better for hospital purchases using UASI funds than we do for the Homeland Security Grant Fund program. So if the hospitals would like to bring forward a project for UASI, our usual project is PPE kits and PAPR filters. I don't know if you guys want to look at doing that again.
Do we need to replace actually the motors and the kind of hardware?
I don't know, Monica, if the original PAPRs are kind of even supported anymore for pieces and parts. They're really replacing those for the other, not PAPRs. What are those? Jason, you guys bought those things.
The Max Airs?
Yeah, like with the Max Airs, the different kinds, they're actually replacing them all.
Yeah, I mean, I think that's good clinically. I'm talking about, CBRNE type, pre-hospital, right outside the hospital, decon.
Oh, okay.
Hey, Beth, this is Tom. Have you talked to Bruce Elliott about the plans that they have discussed about replacing the duodotes?
Kevin, did Bruce bring that up? I know they brought that up at the meeting. He asked basically how many duodotes were replaced the last time. So I believe maybe the EMS committee is planning on requesting funding to replace those duodotes. I remember we
That
planned.
is correct.
Yeah, okay, so yeah. So Tom, they are, so Bruce is on top of that. And he'll be requesting that through the EMS committee. All right.
And then the other thing, Rebecca, and I don't know if it was Cuyahoga County, well, the cyber security. I know that was a request. Was that for Cuyahoga County or Cleveland, or who requested that?
That was for Cuyahoga County. And I believe the justification said that the medical examiner's office was included in that. That kind of got, we requested the whole amount of funding for that. And they, the main committee split it up. So only the initial assessment and kind of plan write-up will be funded through, it's so confusing, will be funded through like this committee. So they got approved for like, I think what, $50,000 or something just for the initial assessment. Then the other stuff, the hardware and all the software and everything that is supposed to go into their cybersecurity hardening was put on the docket for the, I don't know, correct me if I'm wrong, I think it was the CARES funding, or there was, the CARES Act funding and the COVID funding. Leslie was supposed to get back to me, and I never really heard whether it was approved through that funding stream or source, but I know that, and Larry, I don't know, maybe you know too, but maybe I know that the initial assessment of the buildings were approved through this committee, through the CCESAB committee.
That the funding streams are definitely split up. The RFP or RFB or whatever RFQ should be going out soon for the assessment. And then after that, once that is complete, they'll look at doing the next phase, which is the actual hardening, et cetera. So it's a phased project, and I believe you are correct in that some of those funds are coming from COVID-related grants. So.
This is Larry. I only know of the 50,000 from the 2021 State Homeland that was approved for the Board of Health's cybersecurity. And as Kevin mentioned, that'll be going out in the not too distant future. The problem is that there's a hold from the feds on the state's money. And so we can't incur any costs. And that means we can't enter into any contracts until the feds have released the awards to Ohio EMA. So we don't want to start going down a road that we can't continue down. So as soon as that stuff's available, we'll be moving ahead with working on this RFPB, whichever the last letter turns out to be.
Thank you, Larry. And is 50 grand enough for that initial assessment? It seems light, but.
That's a different conversation. That's out of my league.
Got it. Okay.
Yeah,
That was, that number was developed in concert with our information security officer here at the county, who sits on some CCESAB boards. So I have a feeling they'll be doing some of it in-house.
Okay, thank you.
yeah, I think it was, the Board of Health came up with a real big, long list of what they really needed with, and they, they'll be working with them. So we just haven't heard too much back about that. All right. Any other projects that we want to put in? We just got our PAPR filters, so they were just released. We got those from the UASI project. So those are usually good for about 4 to 5 years, I think, before they expire. Any other public health or hospital, medical examiner, any other projects we want to put forward? Okay, hearing none, less work for me. All right, so what I hear is our priority justifications for the May UASI grant will be the medical examiner's office request for a portable cooling system for mass fatalities, preferably 2 systems to fill the mass fatality target gap. So may I have a vote that this is our only number and this is our only justification project that we're putting forward? May I have a vote, a motion to support this #1 medical examiner's request? And I think we'll put in for what, 80,000? Or do you want to go higher than that? Should we ask for 100,000, do you think?
Yeah, in case there's inflation.
There is.
Yeah. All right. So we'll put in a request for 100,000 for the medical examiner's office portable cooling system for mass fatalities. Is there a motion to approve this request?
Well, I don't know. I mean, just a little bit more discussion on the wording of the motion. Hugh, should it be, or Larry or anyone on this call, specific to 2 24-inch trailers or 2 units, or?
So it's two cooling units that will support the preservation of 24 bodies each.
And they're mobile, right? Meaning,
Correct.
it can be at point A and another one could be at another location.
Right.
So I think whoever's going to make that, and maybe that's you, Hugh, make the motion, maybe include that. Can Hugh make the motion on behalf of his own?
I find it in poor taste usually, so. But if I have to, I will.
Well, I will make the motion for $100,000 to support 2 mass fatality cooling units for the medical examiner's office.
Okay.
I will second that.
Who is that, Hugh?
Yes.
Okay. All right. So let's go with, is anyone opposed? Speak now or forever hold your peace. Okay. All right, then the motion is carried to put in 1 priority justification of $100,000 for the medical examiner's office for portable cooling system.
For two portable cooling systems.
Right, 2 cooling units to support the preservation of 24 bodies apiece.
I will work with Larry on the language.
Okay, yeah, work with Larry on the language. All right, great. All right. So that motion is carried and I'll approve.
And the detail would be, it's carried by unanimous consent, just for the record.
Unanimous consent, it's carried. Okay. All right, I'll get it together.
You have it together, Beth.
Don't I though? Ugh. Okay, very good. Okay, well then that, moving on to our next agenda item, any announcements or other business to discuss? I just have one. The Healthcare Coalition Conference venue was changed to the Parma Snow Road Library. That is our June 3rd conference. The registration is now open and 77 out of 150 slots have been filled so far. So register now, it's free. And food will be provided, good parking, good networking.
And maybe a PE or two.
Yeah, yeah, there you go. All right. Any other announcements, other business? I don't know if there's anything else going on in the city.
What's the
At this
status of
time.
the Homeland Security Conference?
Oh, yep. Does anybody want to put a plug in for that and have more information? I don't know, Kevin, if you have more. I know it's kind of a city of Cleveland thing, but I don't think anybody from the city is on.
So it is July 11th through July 14th here in Cleveland. It's the National Homeland Security Conference at the Huntington Convention Center. Everything I've heard is that it's a great conference to attend. It is more geared towards Homeland Security versus emergency management, but there's a lot of overlap between the two. So if you would like to register, it's nationalhomelandsecurity.org is the website.
Okay. All right. Okay, are there any other announcements or other business that we need to discuss? All right.
Well, maybe just for socialization, if you guys aren't aware, Metro Health's main campus, we're going to be moving our patients in mid-October from our old facility to our brand new state-of-the-art facility. So,
Oh, congratulations.
well, let's do that at the end of October. But
Okay. All right. Very, very good. Anything else? All right. Our next meeting is to be determined if the CCESAB bylaws are changed by next quarter. We may be with the Emergency Management Subcommittee. I think, Monica, you sit on that committee already. Yeah, so we will just, Center for Health Affairs will just join you as a representative to that meeting too. All right. Anything else anyone wants to bring forward? All right, then we will close this public meeting. And I think I need to call for a motion to adjourn. Anybody want a motion to adjourn?
I think everyone still wants to meet.
Do we all want to be?
Justin Bechtel. Motion.
Second.
And Hugh, okay, Justin and Hugh, okay. All right, very good. Well, if we don't see you next time,